to be changed totally?
As I have said, this strategy worked in the National Capital Region. And it doesn't mean that in toto, ayun mismo rin yung gagawin mo. Sabi nga natin na we will adjust and adapt to the situation. But right now, what we really have to do is actually reinforce our healthcare capacities, help our doctors, nurses, health workers. Normally kasi, ang unang tinatamaan din talaga yung ating mga health workers. Now, if you look at our hospitals, many doctors and nurses are also infected. And the people around them are under quarantine. So kailangan ay ma-replenish natin sila because kung wala sila, ay lalo nang kawawa naman yung ating Cebu kung ang ating mga pasyente ay hindi mabibigyan ng magandang atensyon. No? Kaya nga ang PPEs ay napaka-importante. In Manila, 20% ng ating casualties before ay health workers. In fact, 32 doctors and nurses, doctors ay talagang sacrifice their lives. No? So, dito naman sa Cebu ay hindi naman natin masasabing gano'n na talaga kalala. No? We place them under ECQ para maagapan natin yung situation and flatten the curve and even actually make the curve decline.
Okay, thank you, Secretary.
Thank you very much, Ryan. Now, let's have DYMR Radio Pilipinas, Carmel Matos, please.
Good afternoon, secretaries, and good afternoon, our local government officials. I'd like to address my question to Secretary Roy Simato. Sir, you've mentioned earlier that you will be assessing the situation in the city. May we know which areas will you be first visiting? Does that include the cities that are currently having a high number of cases of COVID-19, like Barangay Mambaling, Barangay Bariulus, and what are other areas that we are planning to visit to really see the gravity of the situation here in the city, sir?
Yes, that's really my intention to go down, to go to the place. I remember Mambaling, ito yata yung lugar na nandyan yung high alay dati eh. Ito ba yun? Para maalala ko kasi mabisado ko pa yan. Oo, yan. Lapit yata sa ano yan eh. Yung Cebu Technology Station. Cebu? CIT? Oo, yun. Malapit nga doon. Doon sa Mambaling eh. Pagkalam ko going to Talisay. Yeah, I still know that. And yun, I will be going there and i-check ko yung the configuration of the barangay. Kasi ito yung aking ginagawa plano. This is a plan. I'm not supposed to be telling this sa plan, but just only beginning. If really hindi na natin talaga mag-contain ng gusto yan, we have to further lockdown doon sa lugar na yan. Meaning, it is a lockdown within an ECQ. Parang ano lang muna doon. Ma-emphasize the gravity of the, para ma-stop ba yung bleeding doon. And I was told that the Mambaling is the highest yata ito, yung Mambaling. So, highest and total number. So, that's really very, Kasi doon sa Manila, hindi ganito sana, NCR, hindi ganito ang kagrabe. Yung quickness ng niya, pabilis. But since if that happened here in Cebu City, we have to do it. And that is really a bitter pill to swallow rather than making the whole city really being in danger sa pagtaas uli ng virus. So yun ang aking I will be going there down talaga kung makausap ko yung barangay captain because the mayor and the barangay captain is the authority to do some we call it granular lockdown as far as the IATF protocol is concerned.
Thank you very much. Do we have a follow-up question?
Yes, a follow-up question, Mr. Secretary. Yung Mambaling area po, which I am currently residing, medyo malapit din po yung areas kung saan yung maraming cases. But I have to ask you, sir, if will we implement a total lockdown sa sitio lang po kung saan maraming cases reported, specifically in Sitio Alaska and Mambaling, or will we implement a total lockdown in the whole barangay Mambaling just to contain the virus, sir?
Yes, kasi yung area na yun, may mga kasi dati diyan sa Mambaling yung magkakalapit ng mga bahay-bahay. At that time hindi ko lang alam ngayon kung the sudden increase of the number of infected kasi that can be attributed to that. Hindi na anong tawag noon, yung isa sa isang malaki na yung R of R of 2, R of 3 na nga yung mangyayari yan. So ayun nga, titignan ko yan ma'am, yung ating tinatanong mo, then we will really find out really the reason bakit biglang naglumubo ang Cebu City. Ang bilis ang paglubo.
Thank you, Mr.
very
Secretary.
much. Thank you also. Now, this next question comes from Vanessa of Cebu TV. Vanessa? Hello, Vanessa?
Yes, hello. Good afternoon. Okay, thank you. I would like to address the question to the IATF officials present. Sirs, we would like to know what is the status of the Cebu Province request to downgrade from its GCQ status to MGCQ. This question is actually from Cebuanos who want to know, are we going to be dragged down by the Cebu City situation, or we can move on with our lives?
Dagang hapon sa inyo. Good afternoon, ma'am. Yung the provincial government led by Governor Gwen Garcia will formalize her appeal before the interagency task force. She essentially has two appeals. One is for the Talisay City to be de-escalated from MECQ to GCQ. The province, by and large, is under GCQ. But in our dialogue with the good governor, she has manifested that she will write a formal request or an appeal to look at certain areas that will certainly impact on the economic activities of the province, and that she would like the IATF to reconsider those areas, especially the tourists' haven, if they can be de-escalated further to MGCQ. So I think this is an appeal that we will wholeheartedly address as a collegial body. No one in the IATF makes decisions alone. So this is a collegial body, and therefore the way to address it is exactly in that way. Thank you.
Thank you very much, sir.
Right. This time we have someone who will ask the question. Unfortunately, she is not online with us via Zoom. But here's a question from Tex Jimenez of GMA Manila. To General Simatu, Secretary Duque, General Galvez, and General Anyo, what is your initial assessment? What is your initial assessment of how Cebu residents follow quarantine rules like wearing face masks, social distancing, and etc.? Secretary Dino said Cebu's discipline is needed.
Well, I think we have not gone around enough to make any assessment as to compliance of the citizens with the minimum standards for health. Although we've seen some packets of people, walking around and some without masks, I'm sure that cannot be an indicator to judge, the whole city just because a packet of communities or people obviously do not comply with the minimum health standards. But that is often taken for granted, if not ignored by some people. And this is not unique to Cebu. It is also happening in other places. And that is why it is incumbent upon the leaders of the LGUs to really drill down the importance of minimum public health standards, masking up like we do, frequent washing of the hands the right way, 20 seconds, cough etiquette, using the crooks of the elbow, and also using disinfectants, sodium hypochlorite, to apply on the surfaces of inanimate objects, tables and chairs, so that that way the virus is neutralized and is unable to infect. And also the other minimum health standards, putting in place the engineering controls, like the social distancing markers on the floor where there is a high density of people coming to and from, and also putting up of physical barriers in certain high density areas. And all of these will give value to the overall response strategy against the pandemic COVID-19. There is no one effective strategy. It is really a set of interventions that ought to be understood in the light of the fact that each of these must build on each other, so that it becomes one, big push to really neutralize, mitigate the effects of COVID-19 infection. And if not done, you will expect rapid transmission, more outbreaks, community transmissions become sustained. And this is really very unfortunate, because this is exactly what we are avoiding. And take, for example, Cebu City. The IATF is here precisely to look at the reasons for its having been imposed upon the ECQ, which is number one, the case doubling time has fallen below 7 days, which puts it at a high risk, and also the critical care utilization rate, especially among the private hospitals, has really skyrocketed to beyond the warning zone, and almost breaching the danger zone. And we are here to help to complement the human resource for health requirement of the private and the public hospitals. And that we have done. We are in constant coordination with the CHD Region 7, and I have reminded him time and again to promptly respond to the gaps in the human resource for health requirement. And then, the third reason for why the city has been put under ECQ is, of course, the high positivity rate, averaging anywhere from 18% to about 33% at the highest. And this is really a cause for concern. And that is why, again, through the IATF, we should be able to collectively address this in more definitive action and interventions. Thank you.
Thank you very much, Secretary Duque, for those very insightful information. From the same media outlet, but this one is for the Cebu City Vice Mayor, Mayor and Governor Garcia. For Gov and Mayor, what is your reaction regarding the appointment of General Simatu to oversee Cebu?
Good afternoon. Good afternoon, our televiewers. Good afternoon. First of all, General Simatu said during our meeting this morning, this morning, that he is happy to be back here in Cebu. And my reply was, likewise, we are also very happy that the President assigned General Simatu here in Cebu to help us. Of course, we cannot question the wisdom of the President and the reasons for his sending here General Simatu. And I, for one, is a great fan of General Simatu. He made wonders, especially in the case of Boracay, that in a span of 6 months, he was able to transform Boracay of what it is now today. And his presence, and of course, the Manila Bay is one of those. And of course, we are happy that he will be with us, working with us. As we said, always over and over again, that we should heal as one. And we are happy that the President is, or showed his concern to Cebu City and to Cebu Province. After all, his roots are from Cebu. But I just would like to take this opportunity to answer the question I earlier propounded to General Simatu. Well, it's understandable because you've just reported today. The question about Mambaling. Well, Mambaling, the particular sitio is Alaska. It used to have 697 positive. 90% of them were asymptomatic. And of late, I am glad to announce that about more than 600 recovered, although there were about 3 or 5 deaths. But the remaining active cases now in situ Alaska is about 17. 17. So just like situ Zapatera, they used to have about 200 positive asymptomatic, and now there are only 15 left because the rest recovered. Thank you.
Thank you, Mayor. May we have Governor Garcia's reaction?
First of all, I'd like to thank the President for sending not 1 but 5 secretaries to Cebu. And I think that's a clear indication of how much the President really values Cebu and values Secretary Mike Dino, because I think this is upon the request also of our Presidential Assistant for the Visayas that the Cebu situation be looked into. The presence here now of Secretary Simatu, Secretary Duque, Secretary Lorenzana, Secretary Anyo, and Secretary Galvez has given us the opportunity, we Cebuanos, both the province and the city, to present a clearer picture of what the situation really is. Furthermore, as governor, I believe it is my duty to emphasize that the situation in Cebu City may not exactly reflect what the situation is in the entire province. And I think we made that very clear in the meeting that we had earlier. So I am grateful, in fact, because I was again able to enunciate my appeal that the province of Cebu will be considered for downgrading to MGCQ in some areas where there is very little or even 0 cases of COVID-19. But Secretary Simatu will be with us for a longer time. Magbinisaya ano niya ni siya, iniguli niya ngadto sa Manila. Because welcome Secretary Simatu. You are very welcome to be with us and involve yourself in the Cebu situation.
Thank you very much, Governor and Mayor, for your words. Next, we have Nestle Similia of Inquirer. Can we request you to please say your question?
Good afternoon. My question is directed to Secretary Anyo or Secretary Simato. Will there be a proper investigation as to the reason why we were put in GCQ at a time when there were recommendations that the city was not ready, thereby doubling the numbers within only 6.5 days? Who will be answerable for this decision? And can you give us a clearer possibilities if Cebu City will be on hard lockdown, sir?
First of all, yung sinasabi mong investigation, I don't think there is a need for that because we have been constantly communicating and consulting with each other, even through the RIATF. In this pandemic, talaga namang in the whole world, no government is prepared for this pandemic. Sabi nga ni Secretary Duque, this is a 6 months old virus. And all governments in the world are actually trying to make their own interventions, and we learn from each other. So in the case of Cebu City, we believe that everyone acted in good faith, and they acted based on what they believe that are really necessary. And that's the role of the IATF to help the LGUs, the different areas, and even to intercede if there's a need, so that all actions, programs, activities will be designed towards fighting the COVID. Now, on the lockdown, we are implementing what we call localized or focused lockdown, and we have this what you call zoning strategy. So, meaning to say, it's not necessarily that the whole area should be, except for Cebu City, which is under ECQ. For those areas under GCQ, they can actually implement localized lockdown. And there are criteria or parameters to follow. For example, if there are at least 2 new cases within the span of 7 days, our mayors can impose a lockdown, whether it is a street, a building, a subdivision, a neighborhood, or the entire barangay. And it has to be looked into what the granular data is presenting. No? So, hindi naman kailangan na i-lockdown mo lahat. Now, in Cebu City, of course, ECQ, we have to impose what we call omnibus guidelines defined in this guideline on how to implement the ECQ. So, and we will help Cebu City on this. That's why Secretary Simato, who is our known as the troubleshooter, both international, now also in local. No? And pagtutulong-tulungan po namin yan. No one is left behind.
Thank you, Secretary Anyo. There's a follow-up question from Nestle still. Nestle?
Yes. Secretary, are we going to expect an extension of ECQ? And what are the criteria or situation for an extension of ECQ?
Again po, ayun ay based pa rin doon sa sinabi kanina ng Secretary Duque, yung case doubling time or case doubling rate, tapos the healthcare utilization rate. Doon po yan magbabase kasi doon po natin makikita kung hindi natin na-contain, no? Patuloy pa rin dumodoble. So every 14 days ay nag-a-assess tayo at pinag-aaralan natin kung ano yung susunod na classification. And mayroon din namang venue na makapag-appeal ang ating LGU kung gusto nilang i-question yung latest classification. So ito ay always a continuing process of consultation and following the standards set by the IATF.
Thank you, Secretary Anyo. And thank you to Nestle. This time, Mr. John Reyes Avedra of Philippine News Agency. Please go ahead.
Good afternoon, sirs. My question is addressed to Secretary Francisco Duque III. Sir, hindi po ba kinonsider ng DOH yung case ng Cebu City as second wave of the virus? Ang second na tanong ko po ay addressed to Secretary Simato, although you have already said yung mga problems and solutions. I would just like to know if you can enumerate the problem areas where you can focus on to solve the crisis in Cebu City. Thank you, sir.
We do not consider the imposition of ECQ in the reasons rather as constituting the second wave. It's still part of the first wave. This is a pandemic wave, as a matter of fact. No? So it's a continuing, sustained transmission. Although, of course, because of the breach in the case doubling time and the critical care utilization rates and the high positivity rate, that objectively served as the basis for the imposition of the enhanced community quarantine. But we are confident, for example, that Cebu City, which has a less than 7 case doubling time of less than 7 days, it's not as if it's down to 2 or 1 or 3. It's 6 point something. It's very close to the moderate risk zone once it reaches 7 days case doubling time. And I believe that they will be able to handle this. They will be able to improve their case doubling time to anywhere between 7 to 30 days. No? And that will help make them graduate from ECQ to hopefully even a GCQ or an ECQ. So it depends on how aggressively the city addresses all of these parameters or indicators. No? This is a set of metrics that they need to really very closely monitor. No? So case doubling time, a critical care utilization rate, the high positivity rate, which is a function of really inadequate testing. So we need to ramp up testing. And this is one of the reasons why we are all here, to provide assistance by way of 2 PCR machines and about 10,000, Charlie, 10,000 kits, testing kits, and other paraphernalia for hospital care, like the high-flow nasal cannula that will really help patients, critical patients, no, to recover much more quickly. And so, again, the answer is it really depends on the city's aggressiveness to address all these indicators in the most positive ways. Thank you.
Thank you very much. Now let's move to Sunstar Cebu, Wenelin Sabalo, for her question.
Hello, good afternoon, everyone. My question is for General Secretary Anyo of DILG. Secretary, if Cebu City will still be placed under the enhanced community quarantine status after June 30, will you give Cebu City a third tranche of cash aid, like the social amelioration program? Though initially SAP is good for 2 months only, but still people will be following the no work, no pay. So what assistance can we still give the city, if ever? Thank you.
Yes, you're correct. Wala na tayong SAP, no, because sa batas ay 2 buwan lang yung na-cover niyan. But the government will continue to provide food reliefs, food packs, and other form of amelioration or assistance, no. Ang DSWD naman ay mayroong resources to provide that. Of course, pagtutulungan niya ng LGU at saka ng DSWD. Pero yung SAP talagang hanggang second tranche lang talaga tayo.
Thank you very much.
Okay. Follow up po.
Yes, please.
To Secretary Duque po of DOH, will you bring in doctors and nurses from Manila to help here in Cebu City?
There seems to be no indication of that as of the moment, because I understand that the region CHD7 DOH has already complemented the human resource for health requirement of many of the private hospitals. After, of course, having satisfied the HR requirement itself of our public facilities like the Vicente Soto. So I think the best person to answer that question would be Director Bernadas in terms of whether he needs to have more doctors complement the need of private hospitals. Jimmy?
The need for nurses is already exhibited by our private hospitals. Therefore, we have started deploying. In fact, we have already deployed more than 147. This includes the deployment to our quarantine stations and the infirmaries that are set up for the cities of Cebu and the three infirmaries that were newly installed in Cebu. Now, the private hospitals also received augmentation on nurses. Not yet, they have not requested for physicians, although Cebu doctors has signified to at least receive the underboard physicians that are ready for deployment. They are ready to be deployed and they have requested 5, but we are still arranging for this. It can be deployed anytime the next few days.
Thank you very much, RD. Thank you.
Thank you, RD.
All right, this time there's a question coming from, yes, Philip Serojano of Super Balita, Cebu. He sent this message and this is directed to Mayor Labella. Mayor, may I ask if the 5 clustered clinics in the city of Cebu to cater the 80 barangays are still functional, and the city are we still conducting testing for COVID-19?
Yes, actually we have strengthened our cluster clinics, and as a matter of fact, for each cluster clinic, we have 5 teams of contact tracing members headed by a doctor. That's true. And of course, we still continue to have massive testing, especially now that we were given 1,000 test kits by the Department of Health. We will continue to do that. We will never stop, as we have started starting late March, and perhaps that could be the reason why our number has increased. But of course, no excuses. There was a surge after we declared general quarantine. Maybe the Cebuanos were quite excited and they forgot that it's still quarantine, and especially at the time when there was this assessment, there was like a backlog that was made part of the data that was given. Yes, we will continue our massive testing. really in order to find out the extent of the pandemic and of course to be able to isolate, treat our patients.
Thank you for that, Mayor Labella.
By the way,
yes,
I just
Mayor.
would like to add something that in order to help our residents of Cebu City, we've just, through the Sangguni and Panlunsod, we've just approved supplemental budget number 3, the amount of 500 million pesos to buy, rice and other supplement to our people during the period of the ECQ.
Good news. Thank you very much, Mayor. Now, this time, our last question. This is the last question. CDN Digital Delta Latillo. CDN Digital Delta, please go ahead.
Good afternoon. This question is for Secretary Anyo for the ILG. There are at least 200 locally stranded individuals in Cebu City who have lost their jobs. They have not been working since the end of April, and they're stuck in Cebu City. They can't go home, Secretary, because of the recent announcement that the LSIs cannot go outside of Cebu City, nor can they go in. So what can we do to help them, sir? Especially that they no longer have income for the next few days.
Of course, number one, let us account for them kung nasaan sila. And I will tell the DSWD to provide assistance to them, food assistance. The reason why we temporarily suspended yung movement ng LSI from Cebu City because hindi rin sila tatanggapin ng mga LGUs na pupuntahan nila. And they will be placed under quarantine. So at least dito ay wala namang inconvenience na aalis sila pagkatapos ay i-quarantine din. At least dito naka-quarantine na sila. And what we are doing now is organizing now the LSI movement. Ang gusto natin ay bultuhan na, hindi pa isa-isa, pa dalawa-dalawa, para organize pagdating doon sa kanilang pupuntahan, pagsalo ng LGU doon, prepared na rin yung kanilang tutuluyan at pati pagkain. So don't worry, the President has given instruction to Secretary Lorenzana and I and Secretary Galvez to take care of our LSI. And we'll make sure that they'll be able to come home when the time comes.
All right. Thank you very much to our members of the media for your for heeding to our invitation. And before we go, we'd request Secretary Mike to closing or parting statement, sir.
Closing lang. I will make it very short now because medyo I think you have to go to the hospitals, visit the hospitals. So actually, again, my heartfelt thank you to the secretaries here. Thank you for taking time to come and help Cebu. Daghang salamat.
Daghang salamat.